Abdominal pain, bloating, changes in bowel habits. Is it IBS? Or is it diverticulitis? These two conditions sound similar, but they are very different, and confusing them can lead to the wrong treatment. Let's break them down in a simple way you'll actually remember. Let's start with what each one actually is. Diverticulitis is an inflammatory condition. It happens when small pouches in the colon, called diverticula, become infected or inflamed. This is a structural and infectious problem in the bowel. IBS is a functional disorder. That means there is no infection, no inflammation, and no structural damage to the bowel. The gut just doesn't work properly, especially in how it moves and responds to stress or food. Here's the easiest way to remember it. Diverticulitis is an inflammation and infection. IBS is a bowel function problem, no inflammation. If there is fever, infection, or elevated white blood cells, think diverticulitis, not IBS. Diverticulitis usually causes left lower quadrant abdominal pain, fever, elevated white blood cell count, nausea or vomiting, sometimes constipation or diarrhea. This person often looks and feels sick. IBS causes crampy abdominal pain, bloating, gas, diarrhea, constipation, or both. Pain is usually relieved after a bowel movement. And importantly, no fever, no bleeding, no abnormal labs. IBS is a diagnosis of exclusion. Red flags that suggest something else, like diverticulitis or IBD, fever, unintentional weight loss, anemia, blood and stool, nocturnal symptoms, elevated inflammatory markers, family history of colon cancer or IBD. If you see these, do not call it IBS. The gold standard test is a CT scan of the abdomen. Labs often show elevated white blood cells and signs of infection. IBS has normal labs and normal imaging. Sometimes doctors use fecal calprotectin to rule out inflammatory bowel disease. If tests are normal and symptoms fit, it's IBS. IBS is treated with diet changes, stress management, fiber, antispasmodics, or gut-directed meds. Typically no antibiotics because there's no infection. Here's a simple memory trick. Diverticulitis, think D for danger, disease, drugs. IBS, think I for irritable, inconsistent, influenced by stress. So remember, diverticulitis is an acute inflammatory disease that makes people sick. IBS is a chronic functional disorder that causes discomfort but not damage. Same area, very different problems. If this helped you understand the difference between IBS and diverticulitis, like, save, or share this for boards and clinicals.